Hello guys, uh, welcome back to my channel. Uh, Today we've got an ethics question, very high yield for you. You're almost guaranteed a question on this concept, so we will read it out for you. A 67-year-old patient with limited English part presents to emergency department with chest pain. The physician suspects acute coronary syndrome. This is basically emergency situation and the patient's adult son offers to translate, which is the best next step. You will all be thinking that we need a translator for this, but actually it's an emergency situation. So we'll read out options first. Accept the son as interpreter because family members are familiar with the patient and can translate faster in emergencies. Okay, it's not making clear, but we'll read it out. The second option, use the son as an ad hoc interpreter only for obtaining immediate life-saving information, then arrange for a professionally trained medical interpreter for the remainder of the visit. This looks very good option because we need an interpreter immediately, not immediately because this is emergency situation. So our son can serve as an interpreter for a short term because it can be we are doing everything for the patient. So patient is our priority. If we waste time in an emergency situation to arrange for an interpreter, the patient can die. So this we need to have the son as an interpreter for short term and then arrange for a professionally trained medical interpreter. So we'll read out the rest of the options. Decline this and wait until a professional medical interpreter is available before asking a question. This is wrong because this is an emergency situation. Have the son translate but ask another staff member to witness and sign the consent note. It doesn't make any difference if the staff member is present or not present because the limitations in interpreting medical knowledge would always be there. It doesn't make any difference. Use a written translations tool instead of an interpreter because it's quicker and avoid family bias. Okay, we cannot trust technology. Don't trust technology. Okay, we need technology in certain case. I'll tell you in which case. Don't trust technology. Not reliable. Not reliable. We need when it's a spoken language. When a deaf patient comes, we need sign language interpreter. Okay, sign language expert. Okay, but when the sign language expert is not available, we can use technology, computer assisted interpretation, uh, transcription, that is, computer assisted transcription devices. So we can use that in sign language transcription. Okay, now I'll tell you more high yield information about this case, that is medical translator. This is the concept heavily tested on USMLE. I'll tell you quickly all the main points. First of all, we need a medical translator. A family member cannot serve as the translator in routine cases, except there's emergency. You can use it temporarily. That's it. Family member cannot serve. Only it can serve for translation only if the patient wants it. Patient requests it. So that's it. The position of interpreter is vital in spoken language translation. The interpreter should be present slightly back and side to the patient. Okay, remember this. Very, very high yield. I'm talking very high yield point this. The position is very important of the interpreter, slightly back and side to the patient. Okay, for sign language, the interpreter should be present to the back of the physician. So you are understanding the concept behind it, uh, because patient needs to see the signs. So and physician is talking to the patient directly, not the interpreter. That is very high yield as well. You need to talk to the patient, not the interpreter, and ask one question at a time, short phrases, and use teach back method. That is, the patient should always sum up the medical information he has understood in the conversation. That would be very essential. So, guys, this is all the high yield information about this concept. Watch the video again if you don't understand. Thank you. Goodbye.